We already heard a lot about reasons to perform systematic reviews in laboratory animal science, and I think I don't even need to summarize it anymore, and I hope you all are convinced by now that we need to do that. But to be sure, I just will summarize them anyway. To obtain, of course, a more objective overview of available knowledge, for finding new results, and I will show you that later in this presentation as well. To improve the quality of primary studies, which might be clear by now as well, and to improve the translation from animal research to the clinic. But writing systematic reviews in laboratory animal science is not that easy as some of us might expect, because it is quite different from the clinical situation. That is because we work with many different animal species and not only humans. And we have many different experimental designs. And last but not least, it's been said before today for many times, there is a problem with the completeness of the scientific literature concerning animal experimentation and often poor scientific quality, the problems with randomization, blinding, the outcome measurements, etc. So, how can we improve the scientific literature concerning animal experimentation and solve the difficulties in performing systematic reviews? At the 3R Research Center, and now Circle, as Merel just told us, our new name, we develop tools to facilitate the execution of systematic reviews in our center. But we also develop methodology and guidelines for systematic reviews, and we educate students, especially within the Radboud and in other universities, about systematic reviews. Now, when I started at Circle, a 3R Research Center at that time, I decided that I needed to experience the obstacles in writing systematic reviews myself and then start to write and develop guidelines. So I chose the subject, the effects of omega-3 fatty acid supplementation in experimental animal models of Alzheimer's disease, because it was the topic of my PhD project, and I'm supposed to know the literature, so that helped, of course. But I already experienced some obstacles at the searching process, because I expected at first that just typing a few search terms for omega-3 fatty acids, a few for Alzheimer's disease, and then the limit animals in PubMed should be enough. But I ended up with a search strategy something like this, and you can imagine that I needed help from librarians to do this. First of all, finding all the animal studies was quite difficult, because I expected to use the limit in PubMed for animal studies, but if you use those limits, you will miss the most recent studies. Then I thought maybe I'd just exclude the human studies, but you can't do that either, because if you exclude the human studies, you also miss studies in which both humans and animals are used. And then there are errors in the thesaurus terms, for example, the mesh terms. There are papers which are clearly, for example, about pigs, and they don't receive the mesh term pig or animal. And then we have many different species, spelling and synonyms. So only for the mice, we have many different search terms which we should to include. Now, therefore, to make the searching process easier, we developed search filters for finding all those animal studies in both PubMed and in Embase. And these filters are open access available, and you can just copy and paste them into the search bar and find all the animal studies. But then we're not there yet. So we now finally know how to find the animal studies, but searching is more than only finding the animal studies in this case. And you need a very broad knowledge of the specific databases. And most scientists, including myself at that time, are not trained to execute really a comprehensive search strategy. And there are plenty of books and courses, but they are long, and we needed a compact guide. So that's what we developed last year. Then we came at the part of assessing the study quality. And also there I experienced a few obstacles. There is indeed large heterogeneity between the studies, and that is obviously because we use many different animal species and also experimental designs. But there are, as others said before as well, many different outcome measures for the same parameter. And again, it became clear in my example about omega-3 fatty acids that indeed the scientific quality is low. Only 7% of the papers blinded the outcome measurement, 15% mentioned or described the dropouts per group, Fortunately, 70% randomized, but no one mentioned the method of randomization. So that's why we developed the gold standard publication checklist. The goal of this checklist is to make scientists more aware about what they need to describe in their publication, but also to decrease the variation between the studies and increase standardization. And this will lead to an improved scientific quality, and the results of systematic reviews will be in the end more reliable. And it will also reduce in the end, that's what we hope still, the number of animals, because if the noise is low, the signal is easier detectable, and we need to use, or we can use probably less animals. Here you can see an overview of the list. Don't worry, you don't need to read it. It's just an overview, and I will highlight a few things. What we want, for example, and it's very obvious, that people describe their experimental design. Did they randomize the group? Did they blind the outcome measure, etc.? But also a short description of their experimental groups and controls, the designation of the strain, the origin of the strain, the experimental unit, the gender, and the age. It sounds obvious, but like you heard before, it's often not the case and needs to be improved. But also housing conditions are very important, and many scientists don't think about that. The animal room, the temperature, the cage, the number of animals, etc. And one example is that the temperature of the room influences the toxicity of many drugs. So it needs to be known, at least, what it was in the rooms. And also the number of excluded animals and the reason for exclusion to minimize misinterpretation of statistical outcomes and increase hazards in translating the benefits of the drugs. At the phase of extracting data and analyzing the results, again, I experienced that we indeed use many different methods, scales, and units of measurements. For example, for neuronal laws of neurodegeneration, we noticed that some people measure within Alzheimer's disease the width of the hippocampus, others measure dying cells, others measure the amount of synapses, and we need to compare that. Can we compare that, and how do we approach that? Then we noticed that very few studies present all the necessary data in their papers. Only 7% of the papers had everything present, the number of animals, the mean, and a measure of variation. So we needed to contact the authors, and the problem there was that many authors did not want to provide the necessary information or did not have it anymore. So again here, I say the same as Merel did. We need open access databases with all experimental animal data in order to perform systematic reviews in the future. Last but not least, and that's the fun part, I think, is interpreting and presenting your data. So what resulted from the example I gave you when I started, from the systematic review about omega-3 fatty acids. Now, first of all, it indeed gave a clear overview of the situation, which I will show you later, and it gave us new insights about the disease and about experimental animal Alzheimer's disease, something like that, and without using new animals. First of all, it became clear that indeed omega-3 fatty acid supplementation reduced the amount of amyloid beta. It diminished the amount of neuronal loss, and this effect appeared larger in female animals. And indeed, also omega-3 fatty acids supplementation improved cognitive function, and this effect appeared to be larger in rats than compared to mice, and the effect appeared larger in males compared to females. And what's nice for us was to see is that these subgroup analysis in rats are all new results without performing new experiments. So I think that for all of us, I hope, it is clear by now that there are some obstacles, but performing systematic reviews are really valuable, and we should do that much more often. And in order to facilitate the systematic review process even more, we are currently busy developing guidelines for writing systematic reviews in laboratory animal science based on the tools and hopefully in collaboration with others. I think this is what I wanted to say, and I thank you all, and now Marlies Leenaars will continue for the rest of this talk about education.
Well, thank you for the attention. My name is Marlies Leenaars, as known, I think, by now. And what I will be talking about is implementation, and then talk about education. And I think it's very important. I took this picture, Mind the Gap. It's from the Underground in London, as you obviously know. I was there last Christmas, and I heard it many times. And it made me realize that's also what's important here within laboratory animal science. A lot of people are not aware that systematic reviews can be a valuable tool for us, and I hear that actually a lot. So what we need is that we introduce the concept within the people working within laboratory animal science. And what we also need is then when people think, that's a good idea, that they know how to do it. And another thing is then continuing education. So people that are working now already need to be aware of these new concepts within laboratory animal science. So what we started introducing the concept is that we did that with new future scientists. We introduced the concept of systematic reviewing within our FELASA Category C course, and FELASA is the Federation of European Laboratory Animal Science Associations. There are a lot of European associations organized together, and they set guidelines what education is necessary for future researchers. And we implemented the systematic review concept there about 3 years ago, and we have about 40 participants in each course, 4 times a year, 3 years. So I think we have now about 480 students who actually heard about the systematic reviewing concept. And what we do there, it's just tiny, but it is that we sort of ourselves sneak the topic into the FELASA course. It's not a part yet, I think, of the course, but we added this up. So we started a sort of small with a lecture. We explain why systematic reviews can be a valuable tool. And we also have a hands-on training in identifying relevant animal studies. And Carlijn showed it, the different steps you need to do. The first thing is, of course, the really explicit, specific question, and that was already explained by others as well. But then you need to find the animal studies. And the course on laboratory animal science, you can focus on systematic reviewing, but when you want to do, when you want to have a nice overview of all studies that were already done, then it is important that you can find all these studies. So when you're not intending to perform a systematic review, it's worthwhile knowing how to find all the relevant animal studies. I think some people may look or think, like the lady over here, there are too many studies out there. How can I find them all? And by having a really hands-on training, people sitting behind a computer, we experience that people understand what they're doing and that it is doable. So that's the good thing of having really a practical there. And well, for this education, we use the tools Carlijn showed us to make it easier, to make the process easier. And well, some quotes we got, and I heard it today also several times, especially after the lecture or during the lecture, almost all the time. They ask, this is so logic. Why aren't you not doing that yet? And well, I totally agree. It is so logic. And especially these future animal scientists, I am glad that I can tell them about this new concept. And that they are aware that this is around and that they can use it whenever possible. And well, when asking was this hands-on training useful, some quotes, search strategies are very handy for my own research. So then I'm happy. Then I were there and they thought that they learned something useful. And I would like to have learned more about systematic reviews. And that's of course something I really appreciate. Yes, because when they then are aware of how, that it may be interesting, how are you going to do it? So that's where we actually put up training in how to perform the systematic review. When you want to do it, how do you do it? We started this in 2010 and we had 4 courses till now. The participants are master students, biomedical science students. They have this education in their curriculum, so they have to follow this this part of for their education. We had about 75 participants till now, and What does it include? They already did the part on identification of animal studies, and then what we do is critical appraisal, risk of bias assessment, data extraction, meta-analysis. We'd also practice with writing a protocol for systematic reviewing, similar to what the Cochrane is asking. And we also talk about data management, and that was something that came across several times already. The problem is when you do a systematic review and you want to do a meta-analysis that you need the data. So that's also an included topic. Well, some quotes here. It gave me a completely different view on animal studies and published papers, and probably especially on the quality of these papers. And also it was very instructive and state-of-the-art. So this is the students that are now here at this university. But continuing education is, of course, also important. So people already working quite a long time within laboratory animal science, they also need to be aware of this concept of systematic reviewing being out there, and that it can be helpful. I mention here especially Switzerland. We have 2 persons from Switzerland here. Merel already mentioned Marcel Geiger. They have in Switzerland already continuing education in place. Animal researchers over there have to have 4 days of education in 4 years when you want to keep your license. And, well, we're not that far in the Netherlands yet. The picture here is of a recently workshop I had together with Alice Tillema, our medical library specialist at Mount Rigi. Very interesting. They organized the Swiss Academy of Sciences organizes continuing education, and then a lot of enthusiastic people come along, and they have intensive training of 2.5 days. But there is hope in that sense that in the new EU directive, which will be active in January 1st, 2013, that there is in place there that researchers should keep up their knowledge and continue elaborate and get to know all things that are out there. So I see that there's an opportunity to actually have the concept of systematic reviewing brought out there as well. And then, of course, when we talk about continuing education, tomorrow, and a lot of you are actually participating, we have a workshop on systematic reviewing, how to perform a systematic review. We have 40 persons tomorrow, 10 from the Netherlands and 30 from abroad. We have 10 nationalities tomorrow, so really happy that we can have this workshop. I saw several persons on the participants list, which I think you are so experienced yourself. You can probably teach us also a lot. So I think it's interesting that we have such a broad interest in such kind of continuing education. And that it is actually continuing education is that it was accredited by LASA, the Laboratory Animal Science Association in the UK. It was accredited in Switzerland, and the Dutch medical specialist ABON accredited this workshop as continuing education, and also the Nijmegen Center for Molecular Life Sciences accredited this course or this workshop as continuing education. Okay. Where are the future plans? Over lunch, I talked to some people and they said, can I also have in Utrecht this kind of course? And actually we're working on that. So not just students in their curriculum, but also for other persons, researchers interested. We try to have education go. We actually got a request from the clinical PhD counselor here at this university, and they said, you have such a nice program on Friday, 10th of February. Can we have this twice a year? In Nijmegen. So I feel that when people see that it is out there, they are enthusiastic and want to join. And what we also want to do is that we have this training to perform systematic reviews on a national level. And Henk Smit just said something about this, and we're actually planning of having this going on a national level. And I put it between brackets, but of course, internationally, I hope this idea of having education go will be picked up as well. And then the topic of assist scientists in performing systematic reviews. After the course of tomorrow, one-day course, you cannot do it yourself. You need all kinds of specialists. You need the persons from the library and maybe a specific person on the topic. And also for the meta-analysis, you may want to go to a person specialized in that as well. So all these kind of things need to put in place to get the message across. And then to finish up, I think when we can make a lot of people embrace the idea of systematic reviewing, we're going to collaborate on this, just do it, and show that systematic reviews have really an added value. We will really manage to have systematic review implemented within due course. Thanks for your attention.
Thank you.